The first alarm from Dr. Xavier Grimes's portable med scanner sent a wave of nervous murmurs through the classroom. The second alarm, a piercing, urgent sound, caused several of the alien students to shift uncomfortably in their seats, 6 eyes blinking rapidly in anxiety. "Professor, your bioscan indicates internal bleeding," said Zentara, a tall Mavonian with pale blue skin and elongated fingers. Her voice quavered as the scanner continued its insistent beeping from where it sat on Xavier's desk. Xavier glanced down at the readout and nodded calmly. "Splenic rupture, probably from the training exercise yesterday." He continued writing equations on the holographic board, as if discussing nothing more serious than the weather. Advanced Medical Procedures for Hostile Environments, Chapter 6. Pay attention, class. This might be on the exam. The 30 alien medical students watched in horror as their human professor calmly walked to the storage cabinet at the back of the classroom. The Interstellar Medical Academy on Proxima Station was the most prestigious teaching hospital in 3 systems, and these students represented the brightest medical minds of a dozen species. Yet, none of them seemed prepared for what happened next. Xavier removed a sterile field generator, several surgical instruments, and a basic region unit from the cabinet. "Today's lesson," he announced, setting the equipment on the demonstration table, "will be a practical example of emergency self-surgery in limited resource environments." Pelnar, a stocky Draxian with metallic scales, raised a trembling hand. "Professor Grimes, the medical bay is only 2 levels down. The surgical team could what, Pelnar? Not be available in a real emergency?" Xavier removed his uniform jacket and began sterilizing the surgical area. "In the field, particularly in frontier zones, you must often be your own surgeon. Consider this a valuable demonstration." The class watched in stunned silence as Xavier activated the sterile field, calibrated the instruments, and then with methodical precision made the first incision into his own abdomen. Threll, a Vexillian student with delicate features and translucent skin, fell from her chair in a dead faint. 2 other students rushed to help her. Xavier barely looked up from his procedure. "Note the entry angle," he said, voice perfectly steady despite the blood now visible within the sterile field. "When accessing the spleen without advanced imaging, you must rely on anatomical landmarks. For humans, the 10th rib provides an excellent reference point." Zentara's voice was barely audible. "Professor, this isn't, you can't possibly what, Zentara? Perform a necessary medical procedure?" Xavier asked, manipulating a clamp to isolate a bleeding vessel. "The human nervous system has certain adaptabilities that your species might lack. I've trained extensively for this." The classroom was silent except for the soft hum of the sterile field and the occasional sob from the back row. Many students had turned away, unable to watch. Others stared in morbid fascination as their professor calmly narrated each step of his own surgery. "The key is controlled breathing and compartmentalization of pain," Xavier continued, voice slightly strained but remarkably composed. "The human mind can—" He paused, wincing slightly, separate sensation from reaction when properly trained. Lorax, a centauran with 4 arms and emerald skin, seemed particularly distressed. "Professor, even among humans, this must be extremely unusual. The pain alone would what, Lorax? Incapacitate me?" Xavier chuckled, though the sound held little humor. "Pain is information, nothing more. You can acknowledge it without surrendering to it." A thin trickle of sweat ran down Xavier's forehead as he carefully repaired the damaged tissue. Several students noticed his slightly elevated breathing rate, the only outward signs of the incredible stress his body was under. "Professor," ventured Krell, a particularly brave Phobosian student, "our xenobiology courses indicated that humans have higher pain tolerance than many species, but nothing suggested this level of control." Xavier nodded as he activated the region unit and positioned it over the wound. Most humans can't do this. It requires specialized training, mental conditioning, and extensive practice. He looked up at the class, making eye contact with several still horrified students. When I was stationed at the Frontier Medical Outpost on Talos 6, I performed similar procedures 3 times, twice on myself, once on another human. No medical facilities, hostile environment, no choice. The Regan unit hummed as it began accelerating cell growth and tissue repair. Xavier's color improved slightly as the unit addressed both the blood loss and trauma. "The first time is the hardest," he added, almost conversationally. "Each subsequent procedure becomes more manageable. The mind adapts, the technique improves." Zentara had moved closer despite her obvious discomfort. You've done this multiple times, as practice?" "Of course." Xavier adjusted the Regan unit settings. "How else would one become proficient? Simulation only teaches so much." This statement sent another wave of distress through the classroom. Several students were openly weeping now, their various physiologies expressing shock and emotional distress in species-specific ways. The Mavonian skin had paled to an almost white shade. The Draxian scales had flattened against their bodies. The lone Tellurian student had extruded stress pheromones that made the air smell faintly of burnt sugar. "I don't understand," said Pelnar, voice shaking. "Why would you deliberately practice such a traumatic procedure on yourself?" Xavier looked genuinely puzzled. How else would a field medic prepare for emergency situations? We can't always rely on proper facilities or assistance. As the Regan unit completed its work, Xavier carefully removed it and examined the newly healed tissue. A thin red line was all that remained of the incision. "Perfect," he said, satisfaction evident in his voice. "Class, gather around. Notice the minimal scarring and proper tissue alignment. The spleen has been repaired rather than removed, always preferable when possible." The students approached reluctantly, many still visibly distressed. Xavier seemed oblivious to their emotional state as he pointed out various aspects of the healing process. "Professor," Krell said hesitantly, "on my world, we have a saying, the healer must first know the wound. But this seems excessive." Xavier considered this as he cleaned the surgical instruments. "An interesting perspective, Krell, but incomplete. In frontier medicine, the healer must not only know the wound, but know how to address it under the worst possible conditions, including when the healer becomes the patient." As Xavier put away the equipment and pulled his uniform jacket back on, the class remained subdued. The educational value of the demonstration was undeniable, but the psychological impact on the non-human students was significant. "For next week," Xavier said, seemingly energized rather than exhausted by the procedure, "read chapters 7 through 9 on emergency neural repairs, and Zentara, please help Threll to the medical bay for observation. Fainting can sometimes indicate underlying issues." As the students filed out, many casting worried glances back at their professor, Xavier began organizing notes on his data pad. Only when the last student had left did he allow himself a moment of weakness, leaning heavily against his desk, eyes closed, breathing deeply. "Computer, seal classroom," he ordered. The doors locked with a soft click. Xavier slid slowly to the floor, back against the desk, and allowed the mask of calm competence to fall away. His face contorted in pain, and he bit his lip to keep from crying out. The procedure had been necessary, the splenic rupture was real, but maintaining such iron control throughout had cost him dearly. "Vital signs recording," he murmured to his personal medical log. "Post-procedure stress response significant but within expected parameters. Pain management techniques partially successful. Recovery time, approximately 3 minutes before requiring public appearance." He breathed deeply, using the meditation techniques he'd learned during his Special Forces medical training. Slowly, the worst of the pain receded to manageable levels. He checked the time. He had exactly 17 minutes before his next class. When Dr. Alara Vex entered the classroom 15 minutes later, She found Xavier reviewing student files at his desk, appearing completely normal. "I heard about your demonstration," she said, her 4 eyes narrowing with concern. As the Academy's chief medical officer and the only other human on staff, she was perhaps the only person who truly understood what Xavier had endured. "Was that really necessary, Xavier?" He looked up, expression neutral. "The splenic rupture was real. It needed addressing." "That's not what I meant, and you know it," Alara snapped, closing the distance between them. "The medical bay is fully staffed. I could have had you treated in minutes." Xavier shrugged, the movement carefully controlled to hide any remaining discomfort. "And miss a valuable teaching opportunity? These students need to understand what's possible in emergency situations." Alara's expression softened slightly. "They're not human, Xavier. What you did, it terrified them. Zentara brought 3 students to my office in acute distress. Threll might drop the program entirely. This, finally, seemed to penetrate Xavier's professional demeanor. "That wasn't my intention," he said quietly. "I know." Alara sighed, perching on the edge of his desk. "But you need to remember that most species don't compartmentalize pain and trauma the way humans can. What looks like necessary practicality to you reads as horrifying self-mutilation to them." Xavier frowned, genuinely troubled by this perspective. "I should speak with them, explain better." "Yes, you should," Alara agreed. "But first, you're coming with me to the medical bay for a proper examination, and don't give me that look. I know exactly what kind of strain self-surgery puts on the human body, even with your training." Xavier started to object, but stopped himself. "You're right," he admitted. "The Regan unit addressed the primary issues, but a full scan would be prudent." As they walked to the medical bay, Xavier reflected on the cultural divide his demonstration had revealed. He'd been assigned to the Academy specifically to help prepare these alien medical students for the realities of frontier medicine, where resources were scarce and conditions often hostile. But perhaps he needed to adjust his approach. In the medical bay, Alara ran a comprehensive scan that confirmed the splenic repair was successful, though Xavier's system showed signs of significant stress. "You're confined to quarters for 24 hours, she declared, reviewing the results. "Your body needs time to recover properly." "I have classes tomorrow," Xavier protested. "Which Dr. Lyrex can cover," Alara countered firmly. "Or do I need to make it a formal medical order?" Xavier recognized the futility of argument. "Fine, but I want to address the students first thing after my recovery. I need to explain." "Explain what?" "Exactly?" Alara asked, administering a vitamin and mineral supplement. "That humans sometimes practice invasive medical procedures on themselves? That self-reliance in medicine can sometimes make the difference between life and death," Xavier corrected. "These students are the future of interstellar medicine. They need to understand the full scope of what that means." The next morning, despite Alara's orders, Xavier found himself in the Academy's garden atrium, seated on a bench surrounded by exotic plants from a dozen worlds. He hadn't planned to disobey medical advice, but after a restless night, the confined quarters had become unbearable. "Professor Grimes?" Xavier looked up to see Zentara standing nearby, her blue skin still paler than normal. "Zentara, please, join me." The Mavonian hesitated before sitting on the far end of the bench. "Dr. Vex said you were resting in quarters." "I find plants more restorative than walls," Xavier replied simply. After a moment of silence, he added, "I owe you and the other students an apology." Zentara's 6 eyes blinked in surprise. "An apology?" "I failed to consider the cultural and physiological differences that would make yesterday's demonstration distressing," Xavier said carefully. "That was an oversight on my part." Zentara seemed to relax slightly. "Dr. Vex explained that humans have special training for such things, that it's not normal, even among your kind." Xavier nodded. "Correct. Special operations medical training. A very small percentage of humans undergo such conditioning." "May I ask why you chose that path?" Zentra's voice was genuinely curious now, fear giving way to professional interest. Xavier considered the question. I grew up on a frontier colony. When I was 14, my father suffered a serious injury during a storm. No medical facilities, no communication. He would have died without immediate intervention. He paused, the memory still vivid. I had basic first aid training. It wasn't enough, but it was all we had. He survived, but with complications that could have been avoided with proper care. So you became a doctor, Zentara said softly. I became more than that, Xavier corrected. I became determined that I would never again be limited by circumstance when someone's life depended on my skills. He looked at the Mavonian student directly. That's why I practice, Zentara. Not because humans enjoy pain or have something to prove, but because preparation eliminates variables in crisis situations. Zentara was silent for a long moment. On my world, we have medical pods that handle all procedures automatically. The idea of touching one's own internal organs. She shuddered slightly. Different approaches for different environments, Xavier acknowledged. Medical pods are wonderful when available. My goal is to ensure you can save lives even when they're not. Over the next week, Xavier took a more measured approach with his students. Instead of dramatic demonstrations, he used detailed simulations and carefully explained the mental techniques that allowed for emergency self-surgery. Many students remained wary, but their fear gradually transformed into a kind of cautious respect. Xavier also found himself learning from his students, gaining insights into how different species approached pain, healing, and medical interventions. The Mavonians, he discovered, had developed sophisticated biochemical pain management systems. The Draxians possessed remarkable tissue regeneration capabilities. The Tellurians could enter healing trances that accelerated recovery. 2 weeks after the infamous self-surgery incident, Xavier found himself facing an unexpected situation. A serious laboratory accident in the xenobiology department had exposed several researchers to an unknown pathogen. Among them was Dr. Alara Vex. The quarantine protocols had been immediately activated, but the alien medical staff seemed hesitant to treat the human patients whose symptoms were progressing differently from the affected alien researchers. Their core temperature is rising at an alarming rate, reported Dr. Lyrax, the Centauran chief of emergency medicine. We've administered standard antipyretics, but the human physiology is responding unpredictably. Xavier reviewed Alara's vital signs with growing concern. This isn't a standard fever response. The pathogen is triggering an autoimmune cascade in human tissue. How can you know that? Lyrax asked, four arms gesturing in frustration. We haven't even identified the pathogen yet. Because I've seen this pattern before, Xavier replied, already pulling on a containment suit. Frontier World Epsilon III, similar response to a fungal exposure. What are you doing? Lyrax demanded as Xavier prepared to enter the quarantine zone. What's necessary? Xavier answered simply. The humans in there need treatment from someone who understands their physiology. You focus on the alien patients. Inside the quarantine zone, Xavier found Alara and 2 human researchers in advanced stages of inflammatory response. Their skin was flushed, breathing labored, and according to the monitors, their organs were beginning to show signs of distress. Xavier, Alara managed, her voice weak, you shouldn't be here. Conserve your strength, he advised, quickly administering an immunosuppressant cocktail he'd prepared. This should slow the autoimmune response while we identify the exact pathogen. Working methodically despite the restrictive containment suit, Xavier took samples and ran them through the specialized analysis equipment. Outside the quarantine zone, he could see his students watching anxiously through the observation window. Send Zentara, Pelnar, and Krell in here, he ordered through the communication system. Properly suited, of course. Dr. Lyrax started to object, but Xavier cut him off. They're top students with complementary specialties. We need their help. When the 3 alien students entered in their containment suits, Xavier immediately put them to work. Zentara, monitor vital signs and prepare to administer medications. Pelnar, your species has exceptional visual acuity. I need you analyzing these cellular responses. Krell, assist me with the sample processing. The student's initial nervousness quickly gave way to focused professionalism. Xavier's calm, methodical approach provided the structure they needed in a crisis situation. The pathogen appears to be triggering specific antibody production in human tissue, Pelnar observed after several minutes of intense observation, different from the response in the alien patients. Cross-reference with known human autoimmune triggers, Xavier directed, administering another dose of medication to Alara, whose condition had stabilized but not improved. I think I see the pattern, Krell said excitedly. It's mimicking human proteins, causing the immune system to attack the body's own tissues. Targeted immunosuppression with cellular tagging, Xavier mused. Zentara, prepare the sequencing gel. We need to identify the exact protein markers. For 6 intense hours, Xavier and the students worked continuously, identifying the pathogen mechanism and developing a targeted treatment protocol. Throughout, Xavier remained focused and methodical, showing no signs of fatigue or stress despite the dangerous conditions and high stakes. When Alara finally regained full consciousness, her fever reduced and organ function stabilizing. She found Xavier checking her vital signs while Zentara adjusted medication levels. You disobeyed my medical order, Alara said weakly. I said 24 hours of rest. Xavier smiled slightly. That was 2 weeks ago, Dr. Vex. I think the statute of limitations has expired. Alara managed a small laugh that turned into a cough. The others? Responding well to treatment, Xavier assured her. The alien patients are also improving. Different mechanism, similar solution. As Alara drifted back to sleep, Xavier turned to find his 3 students watching him with expressions he couldn't quite read through their containment suits. You've all performed admirably, he told them. This was real medicine adapting to unknown conditions, collaborating across specialties, maintaining focus under pressure. Professor, Zentara said hesitantly, you exposed yourself to significant risk by entering quarantine. Xavier shrugged. Calculated risk. The containment suits provide excellent protection, and the patients needed immediate intervention. But you didn't hesitate, Pelnar observed, not even for a moment. Should I have? Xavier asked, genuinely curious about their perspective. The students exchanged glances before Krell spoke. On my world, we would have extensive deliberation before anyone entered a quarantine zone, even with protective equipment. The risk assessment protocols alone would take hours. And in those hours, patients might deteriorate beyond recovery, Xavier pointed out gently. Medicine sometimes requires immediate action based on incomplete information. That's the reality I've been trying to teach you. Like your self-surgery, Zentara said slowly, understanding dawning. It wasn't about pain tolerance or human exceptionalism. It was about doing what's necessary regardless of personal comfort. Exactly, Xavier confirmed, feeling a surge of satisfaction at their growing comprehension. Though I could have chosen a less dramatic way to illustrate the point. The containment period lasted 3 more days before the medical team confirmed the pathogen was fully neutralized. During that time, Xavier continued working with his students, turning the quarantine into an impromptu classroom where theory met urgent practice. When they finally emerged, exhausted but successful, Xavier was surprised to find the entire student body waiting to greet them. Even more surprising was the respect now evident in their eyes, not fear or horror, but genuine professional admiration. I think they finally understand, Alara commented as they watched the students return to their normal routines. She was still weak but well on the road to recovery. What you were trying to teach them all along. Which is what exactly? Xavier asked. That medicine isn't just about knowledge or technology, Alara said. It's about making difficult decisions and taking necessary action even when it's personally costly. 2 months later, Xavier sat in his classroom, watching as his students presented their final projects, emergency protocols for various frontier scenarios. The presentations were thoughtful, innovative, and refreshingly practical, incorporating perspectives from each student's unique biology and cultural background. Zentara's team had developed a remarkable approach to emergency surgery that combined human resilience techniques with Mavonian biochemical pain management. Pelnar had created portable diagnostic equipment based on Draxian sensory capabilities. Krell had designed emergency medical shelters that could be deployed in hostile environments. "Your final assignment," Xavier announced after the presentations concluded, "is a practical examination." The students tensed visibly, perhaps expecting another dramatic demonstration. Instead, Xavier smiled reassuringly. "You will each spend 1 week at the emergency medical facility on Proxima Station, working alongside practitioners from various species. Your performance will be evaluated by the senior medical staff not on your technical skills alone, but on your decision-making, adaptability, and teamwork." As the students filed out, discussing the assignment with animation rather than anxiety, Xavier felt a sense of accomplishment. They had come so far from the terrified class that had witnessed his self-surgery months ago. "Quite the transformation," Alara commented, joining him at the front of the now empty classroom. "From horror to engagement, you've done good work here, Xavier." "They did the work," he corrected. "I just provided the catalyst." "A rather dramatic catalyst," Alara observed dryly. "I still get complaints about nightmares from some of the more sensitive species." Xavier winced. "Not my finest pedagogical moment." "But effective," Alara conceded. "The Academy Board reviewed the class performance metrics yesterday. Your students show the highest practical readiness scores in the institution's history." Xavier absorbed this information with quiet satisfaction. "They'll make exceptional frontier doctors." "Speaking of which," Alara said casually, "the frontier outpost on Talos 6 has requested an experienced medical trainer, someone who can prepare their staff for challenging conditions." Xavier raised an eyebrow. "Are you trying to get rid of me, Dr. Vex?" "On the contrary," she replied, "I'm suggesting we both go. The Academy can spare us for a 6-month rotation, and I think the experience would be valuable for us and for them." Xavier considered the proposal. Talos the Sixth was where he'd performed his first emergency self-surgery years ago, a brutal introduction to frontier medicine that had shaped his approach to teaching. Returning there as an instructor rather than a desperate field medic held a certain poetic symmetry. "When do we leave?" he asked. "End of the term," Alara said, clearly pleased by his quick acceptance. "Just enough time to finish with this class and prepare the next instructors." On the final day of the term, Xavier found himself surrounded by his students in the Academy's ceremonial hall. As each received their certification, he felt an unexpected surge of emotion. They had begun as a group frightened by his demonstration of human medical extremes. They were graduating as confident practitioners, ready for whatever challenges the frontier might present. Zentara approached him after the ceremony, her blue skin now healthy and vibrant. "Professor Grimes, I wanted to thank you before you leave for Talos 6. "For what exactly?" Xavier asked. "For showing us what's possible," she replied simply. "Even when it's difficult to watch, even when it seems impossible." Xavier nodded, understanding the deeper meaning behind her words. The greatest treatments often look alarming from the outside. It's the outcome that matters. "We know that now," Zentara said, gesturing to include her classmates. "And we won't forget." As Xavier watched his students disperse to their various assignments across the galaxy, he reflected on his unconventional teaching methods. The self-surgery demonstration, while effective, had been just one part of a larger lesson about medical realities in challenging environments. The real education had come later, during the quarantine crisis, when theory met practice and his students rose to the occasion. They had learned not by watching him perform extraordinary feats, but by doing extraordinary work themselves. Dr. Xavier Grimes gathered his belongings and prepared for the journey to Talos 6, satisfied that he was leaving behind a class of medical practitioners who understood that medicine wasn't always clean or comfortable or contained within safe facilities, but it was always, always necessary. And sometimes that necessity required more than textbook solutions. Sometimes it required practice of the most personal kind.